Hey everyone, welcome to today's session that is a question and answer session with genetic counselors. In this session, we're going to break down for you what genetic testing is, what genetic counseling is, how you can access a genetic counselor, accessing genetic testing, and answer common questions that come up about genetic counseling and testing. I will be your moderator today. My name is Jillian Hooker, and I am a genetic counselor working in the health IT space. For the last 5 years, I've been volunteering with the American Kidney Fund, serving on their policies committee, working with the Patient Access Initiative, and also working on the Unknown Causes of Kidney Disease Initiative. Um, I think it's really important to note and have a moment of gratitude for AKF and all of the kidney patient advocates who have been among some of the strongest advocates for better access to genetic counseling and testing. And this session really arose out of conversations that we've had at AKF meetings where we talk about some of the policy issues related to testing and to genetic counseling. But one of the most common questions we get is, should I see a genetic counselor? How would I see a genetic counselor? Should my family members see a genetic counselor? And so we thought it was really important to take some time to tackle these issues for the AKF community and for the broader patient and family community around that. So we've recruited two really great speakers to this panel today. And to start, I'd like to introduce both of them, Mary Beth Roberts and Sarah Reardon. Mary Beth is a genetic counselor at the Cleveland Clinic, where she serves pediatric and adult patients. She's also the co-founder of the National Society for Genetic Counselors Renal Genetic Counseling Special Interest Group and has been very active in the nephrology genetic space for over 5 years, which makes her really one of the first. That's kind of a long time in kidney language, kidney time. And she's been supporting providers and patients with education about genetic kidney diseases. Sarah is the Vice President of Strategy at Genome Medical, where she develops plans and implements strategies to advance the growth and adoption of their genetic services and solutions. She's previously served as the 2021 President of the National Society of Genetic Counselors, focused on growing a more diverse workforce, advocating for equitable access to genetic counselors, and developing the 2022 to 2024 strategic plan. I think she brings a really valuable perspective of how you can efficiently access genetic counselors and knows a lot about telehealth as well. So as questions come in, we'll be ready to field those as well. I want to thank you both for being here. And the last note I have before we get started is to remind the audience to be typing their questions into the chat as they come up. They'll be sent back to us. And we're going to do our best to get to as many of your questions as we possibly can. We're going to start with some level setting, and Mary Beth is going to give us a brief, probably introduction to genetic counseling and testing, which is quite a tall order to ask her to do. So I will hand it over to her.
Great. Thanks so much, Jillian. Thank you for the introduction, and thank you everybody for being here. As we go forward, in the next couple of sessions are going to address, hopefully give you the rundown about the role of a genetic counselor, including responsibilities, how we interact with patients, and why they can be an important part of your kidney disease team. We're going to discuss the importance of genetic testing, and I'm going to give you an overview of key genetic things to think about when you're considering whether or not you should request a referral to genetics. And we're going to ask Sarah to discuss how to ask your nephrologist about this testing. And then we're going to share how to connect with a genetic counselor and provide guidance for important conversations about genetic testing for kidney disease. My role today is to provide you a very brief overview of the role of genetics in kidney disease. So to start with, we're going to talk about the DNA double helix. Most of you are probably familiar with a picture that's similar to this. But our genomes are made of DNA, which is this really large molecule that looks like kind of this long twisted ladder. So this is the iconic DNA double helix. And DNA is read like a code. So the code is made up of 4 different types of these chemical building blocks, which we abbreviate as A, T, C, and G. And the order of those letters in that code, much like letters in the alphabet if you're reading a story or a sentence, tells the DNA to function in different ways. And we're really going to be focusing on how those different genetic changes affect our health. The code does change slightly from person to person. So I say, we've all got our different genetic flair or our genetic signature that makes us unique from other people. It's when those genetic changes impact the way that our body performs that DNA changes can be a problem. Let's talk about how genes affect our health. So we get half of our DNA from mom and half from dad. DNA, like I said, has genes, which are like instructions that help our bodies to grow and work. There are generally three main types of illnesses that we think of: environmental, what we call multifactorial, and monogenic or genetic. Environmental illnesses happen because of things outside of our genes, right? So, for example, accidents, being exposed to harmful chemicals, or unhealthy habits can cause these problems. Multifactorial illnesses happen because of a mixture of genetic risks and things in the environment. So most types of kidney disease actually fall into this multifactorial category. So even if your family history makes you more likely to get these illnesses, your lifestyle, like eating healthy and exercising, can often make a big difference in whether or not you become sick. Genetic illnesses, on the other hand, are problems that we're born with. They really don't have much to do with your lifestyle or the environment. These genetic conditions often run in families, but sometimes they happen randomly when a baby's first conceived, even if no one else in the family has the condition. And people with genetic illnesses may need special care or specific medications, which is a really important part of why we're talking about this in the context of kidney disease. Now, genetic conditions can be passed on from one, both, or neither parent, and many genetic conditions affect people in different ways, even when they're from the same family and even when they have the same disease. Genetic testing is most commonly done on blood or saliva and is a way to look at genes to try to find the cause of a suspected genetic problem. So we are focusing again on kidney disease. So an important question that's been floating around for the past few years, and even more so in the past 5 or so years, is when to expect a genetic kidney disease, and who should consider genetic testing. A really big factor is the age of onset, how old you are when your kidney disease starts. In children, we see studies that suggest 50 to maybe 75% of children with chronic kidney disease have a genetic cause. And I tend to think about people coming to see me for genetic evaluation in terms of are they children? Are they young adults? So 25 or younger. We often see genetic problems showing up in adolescence or that young adulthood range. Or even are they younger than 50? So there's kind of a higher chance of something being genetic the younger you are, but still, even in that range between 25 and 50, chronic kidney disease is not normal. And if it's unexplainable, then there could potentially be something genetic happening. Family history is a really strong indicator of whether or not somebody's going to have a positive genetic test. So knowing your family history is really critical. We often see multiple people in a family, multiple generations have problems with their kidneys. And there can be something that's, more obvious, like autosomal dominant polycystic kidney disease, or it can be more subtle, and we're really just recognizing how these different patterns can run in families. Certain characteristics of kidney disease, like polycystic kidney disease, or CKD, which is congenital anomalies of the kidneys and urinary tract, can indicate a stronger likelihood of something being inherited or genetic. So being born with physical structural differences in your kidneys might warrant talking to somebody who knows about genetics. Also, people who have kidney disease where it's not really clear, right? You go through all these tests and nobody can really understand what is contributing to a decline in kidney function, especially if that's running in the family. That can be another reason to consider genetics. And lastly, what we call extra-renal manifestations, so outside the kidney, things like developmental delay or really having a hard time in school. Having seizures, having skeletal differences, not being able to expand, maybe your arms or legs all the way and stuff like that. Vision loss, hearing problems. Those together with kidney disease can indicate or suggest that a genetic evaluation could be something to think about. And then lastly, why is this important, right? So what? Well, it turns out that there are a lot of gene-specific medications for inherited kidney diseases. Things like certain rare forms of kidney stones, for example, has gene therapy, or there's so many examples I could list, but depending on what the underlying genetic cause is, you might get a special medication to treat your genetic disease. On the flip side, there are some genetic conditions that don't have a cure, don't have a specific medication yet, but you may be eligible to enroll in a clinical trial for something. Also, there are some medications used like steroids, immune suppressions to treat certain types of kidney disease that work great for people when it's not genetic, but are not going to have such an effect if it is an actual genetic condition. And so we can help people avoid those medications, which can have, unwanted side effects. There are different things that we can think about when it comes to transplant and genetic kidney diseases. We know that there are some inherited diseases where a transplant is not a cure. The disease does come back, and there are ways to prevent that disease from coming back and affecting the new kidney if we're treating the underlying disease properly, if we know what we're treating. There are some conditions that when we find out, we might test somebody because they've got a kidney problem, but there are screening that we can do for other health systems as well. For example, a young baby who's born with cysts on their kidney or something unusual about the structure of their kidney might get screened with genetics, and then we find out that they have a higher chance of developing diabetes in their 20s. And so we'll be sure to screen them for that. And there are many examples of these types of things in kidney genetics. I think the main thing that a lot of people think about when we're talking about genetics is pregnancy and kids, right? Family. So that's certainly an important aspect of what we would discuss in a genetic counseling session. We're really going to focus on, is this something, is a diagnosis going to help you in your kidney care or your transplant care, but also what does it mean for your family, right? And we can have the discussion about that. Sometimes people are, past their childbearing years, have a grown family, and we're just working on making sure that the rest of their family is screened. Other people might be deciding to become pregnant and want to know what options they have available to them now that they've identified their genetic risk, and we can certainly help with that as well. All right, so I'm going to turn it over to Sarah. Thank you.
Awesome. Thank you, Mary Beth. That was a lot to cover in a very short period of time, and you did a great job providing an overview. I'll remind everyone, if there's anything that raises a question for you, just type it into the chat and we'll try to get to it at the end. But for now, I'm going to hand it over to Sarah to walk us through some of the different ways that folks can access genetic counseling and testing.
Great. Thank you, Jillian. I'm really excited to be here. Thank you all for joining. Just briefly, my disclosures, I'm an employee and shareholder at Genome Medical, which is a telemedicine company, a telemedicine genetics company. So Mary Beth just gave us a wonderful overview of kidney genetics and talked about why genetic testing is so important in kidney disease. And I'm going to talk about how you can access genetic counseling and genetic testing. I'd like to first start with actually what happens during a genetic counseling session. And a genetic counseling session is really a conversation. So the appointments take anywhere from 30 minutes to an hour. The genetic counselor will start by getting to know you and your family history. So the genetic counselor will ask questions about your medical history. We'll try to understand if you have any relatives that also have kidney disease. And from there, the genetic counselor will talk to you about whether genetic testing makes sense for you. And if so, which test might be the best fit. They'll explain what the results could mean, the possibility of uncertain findings, and answer any questions that you have so it can be a really informed decision. If you decide to move forward with testing, the genetic counselor will walk you through exactly how that process works. And once the results are back, it usually takes a few weeks, the genetic counselor will meet with you again to explain the results and what those results mean for you, for your health, and for your family's health as well. So genetic counseling is really an educational process that's tailored exactly for your and your family's needs. So with that background, let's walk through ways that you can access genetic counseling and genetic testing. And there's really two pathways, and both of them work really, really well. So the first on the left is the traditional in-person pathway. And this usually starts with your nephrologist, your kidney doctor, recognizing that genetic testing might be beneficial for you, and then referring you to see a genetic counselor in person. And so you'll meet with the genetic counselor at a hospital or a clinic. You'll have that sample collected for testing, and that's usually blood or saliva. And then the results get returned to the genetic counselor. You can meet with that genetic counselor again, as well as your entire care team. The second pathway on the right is a telemedicine pathway. And here you'll see a genetic counselor by phone or by video. And your doctor can refer you to go see a telemedicine genetic counselor. This is really helpful if your institution doesn't have genetic counselors, your regular medical institution doesn't have genetic counselors, or if the wait time is really long to see one. You can also contact a telemedicine genetic counselor directly. So with a lot of genetic counseling companies, you can just go sign up, schedule an appointment, and so you can really self-refer. And this can work well if you haven't talked with your doctor about genetic testing, or maybe if you don't have an appointment with your nephrologist for a long time. So that's a really great way to get yourself access to genetic counseling and testing. And then the process is very similar. The results will be shared with you. You can share those results with your care team. And something that's really important about these pathways is that genetic conditions run in families. So if a genetic cause is found in you, then your siblings, your parents, and your children should also be tested. And so if a telemedicine pathway can work well, if your family lives in different states, they can actually access the same genetic counselor you saw through telemedicine without needing to find a local provider. So two great pathways that can provide access to genetic testing and genetic counseling. And so one thing I hear that I hear comes up a lot is that what if my nephrologist won't refer me to genetic counseling or genetic testing? And this is not to criticize. There's, as Mary Beth described, there's a lot of new discoveries in kidney genetics, and it's really hard for all providers to be able to catch up and keep up to date on this information. Your kidney doctor may not realize that they can refer to that there's genetic counselors in their area, or that they can refer via telemedicine. So it's always important to advocate for yourself. And so here's a few ways that you can actually talk to your doctor about genetic testing. You can simply ask, could a genetic cause explain my kidney disease? And this really opens the door to the conversation. It lets your doctor know that you're interested in getting these types of answers. You could also ask, would knowing my genetics change my treatment? And because the answer is increasingly yes, it might. And you can also just specifically request a referral to a genetic counselor. As we discussed, if your doctor isn't comfortable referring, you can self-refer to a telemedicine company and be able to get access that way. And I always encourage, please bring your family into the conversation, talk to your relatives, ask if they've had genetic testing, ask your doctor, should my family members be tested as well. And then wanted to talk a little bit, this is really important, that how genetic results can unlock new treatments. And so Mary Beth addressed this a little bit. We now have some targeted disease modifying therapies that are approved for some forms of inherited kidney disease. And a disease modifying treatment means that it doesn't just treat the symptoms of the disease, it actually can slow down or keep the disease from getting worse. And so these treatments are designed specifically for patients with particular genetic diagnoses. So the earlier someone gets genetic testing, the earlier they can start that targeted treatment. And while it's really exciting that we have these approved therapies, there's a lot more that are actually in clinical trials. And being part of a clinical trial is a way to access a therapy when it's still being studied. And deciding to participate in a clinical trial is a really complex decision. There's a lot of potential benefits. There's some risks as well. So you'll want to consider these and make the decision that's right for you. But it's good to have clinical trials as a potential option. And many of these trials actually require a genetic diagnosis in order to enter the trial. So again, having access to those genetic results can give these as option as part of your treatment plan. So I always encourage people to ask their care team, is there a genetic trial that my genetic results might qualify me for? And so the key message I really want to leave everyone with is that earlier genetic testing equals earlier access to the right treatment and the most options for you as well as your family.
Thanks, Sarah. I'm so excited that AKF gave us the opportunity to have this session. We've had some great questions coming in already. Both of you have done an amazing job of really painting a picture to start this conversation. If folks have additional questions, again, you can just put them into the Q&A and type them into the chat box, and we'll try our best to get to every question that's come in. And we'll start with a couple that have already come in. Mary Beth, the first one is for you to dig a little deeper into something you mentioned on one of your slides. We got a question from somebody who has had genetic testing and was found to have a specific mutation associated with their kidney disease. And they wondered if you could say a little bit more about how that impacts the transplant process specifically and and in which cases you might think about somebody's genetic background in thinking about what you might be able to do to prevent rejection in a donated kidney.
Yeah, thanks, Jillian. Great question. So this is something that comes up fairly frequently, and the answer is it depends. So most of the time, getting an unaffected kidney in a transplant when you're born with a genetic disease is absolutely wonderful. People who have a genetic reason for their kidney failure tend to have good transplant outcomes, and that's largely because they often won't have the history of chronic illness that leads to kidney failure for a great deal of people. So they're overall healthier for the most part, which means that they're great candidates for transplant. Where the transplant plan might change, I would say, is if you have a living related donor. I know that's not everybody, but it's important. We actually recommend genetic testing for relatives wanting to donate a kidney if you've been found to have a genetic condition. And then if your relative also tests positive for that same inherited disease, there's a good chance that they would not be eligible to donate. So I think that's important to note as well.
Great. So to the question around transplant, I think this is another one that we'd had submitted prior to the session. So as you're thinking about the timing of genetic counseling and testing, and this is really for both of you, like how long does it usually take to get in to see a genetic counselor? And is it difficult to coordinate the timing, or does that work in your respective settings?
Yeah, I can speak to our center. So access to appointments has been a challenge. We are there's a growing number of renal genetics clinics in the United States, and I think we're uh, one of the first. And so we have worked closely with our transplant nephrology team who were sending us a lot of referrals for transplant, who are getting scheduled months and months out, and everything else is done and they're ready to get that transplant, and they're just waiting for months for the genetic testing appointment, which is not ideal. So we had meetings with our transplant team to add on urgent appointments, to advocate for better communication between departments to make sure that we were getting those people in and getting them seen. I can't speak to other centers, but that's how we've approached that issue. But yeah, I always try to educate our referring providers that genetic testing consults should be ordered early in the process, not the last thing that you do when everything else is complete, because we often take the most time to get seen, and also for those test results to come back and then be thinking about family variant testing. But maybe Sarah can speak to filling the need for those earlier appointments when we are not able to in the clinical setting.
Yeah, definitely. The earlier you can access genetic testing, the better. And so this is where a telemedicine model can be helpful. Often the wait time is less, and it will vary at our company. People can come and be seen within a week to get their phone appointment with a genetic counselor, and then genetic testing ordered. Again, that the genetic results can take a few weeks to come back. But it can be a much shorter time than what a lot of people experience in clinic. And it can be a fast way to access the testing. Once those results are back, then we really want folks to follow up and be seen at a center of excellence that specializes in kidney genetic care. So it's really sort of a shorter bridge to get telemedicine can be a shorter bridge to get access to the genetic test results so that you can then act on them with your local care center.
Great. Thank you both so much. The next question came in from an individual who was diagnosed with kidneys that are too small for their body. So, Mary Beth, going back to some of the things you said about sort of differences at birth in the way people's kidneys are made and when and how that may be an indication for genetic testing, I wonder if you have more you might say about that.
Yeah, sure. So that could fall under that CKD umbrella that I mentioned, which is short for congenital anomalies of the kidney and urinary tract. There are some genetic conditions, depending on other signs and symptoms, which is where that clinical evaluation really plays an important role. Genetic testing may be something that would be helpful to try to find the cause of that. And if there were other issues medically in other organ systems that would also need to be, treated or monitored. So yeah, certainly we've seen people in our clinic for similar concerns, and so that would be something I would encourage you definitely to talk with your nephrologist about, and look into if genetic testing could play a role. I think it could. Yeah.
Great. And now on to a question that everybody loves to hate. I guess the first part is a little bit easier. Does insurance pay for genetic counseling and testing? And then the second part is genetic testing a concern as a potential impact on insurance coverage? Would it be counted as a pre-existing condition for folks? And where do folks have concerns about insurance coverage?
Yeah, Sarah, you probably see a lot more insurances than I do. You want to speak to that?
Yeah, I can speak to that. Genetics, like any other specialty, their specialty health provider, there's differences in what insurance plans will cover, and it really does depend on your insurance plan. Um, and so it's kind of like seeing any other provider that your doctor would refer you to. But a lot of private insurances do cover genetic counseling. And with genetic testing, when someone meets clinical guidelines for testing, very often insurance will cover that genetic testing. So it is two different pieces, the genetic counseling portion and then the genetic test. But it really does vary widely across health plans, and so always good to kind of understand beforehand what your copay, et cetera, could be.
Yeah, and I can also speak to, insurance policy coverage has always lagged behind clinical data and what we as healthcare providers think a good reason to do genetic testing would be. So you might find that your genetic counselor or a geneticist is recommending a genetic test for you, but there's no policy written for that test at this time, for kidney disease in particular. So that's, a work in progress. And Jillian's doing some great work on policy and insurance coverage to help with that. We oftentimes work closely with our genetic testing lab partners to help patients get the coverage that they need, whether that's through a lab specific financial assistance plan or shopping around, to try to find the cheapest self-pay version of the test that's been recommended. So your genetic counselor is always happy to work with you based on your unique needs, financial needs, to see if we can still get testing done in a way that works for you. Um, and then the other question, I believe, was about insurance discrimination. So there is a law that was passed in the 2000s called the Genetic Information Non-Discrimination Act, which we shortened to GINA. With that law, there is legal protection about discrimination based on your genetic testing results in the workplace and from your regular health insurance provider. Um, so there are some carve-outs to that. If you work for the federal government or the military, I believe they have their own um, criteria about that might be similar to that law, but they're exempt from it. Also, if you work at a place, I believe that has 15 or fewer people, or fewer than 15 people, they are exempt. Uh, that law does not extend to life insurance, long-term care, and disability coverage unless you're a resident of Florida. Um, and hopefully that will change, and we'll have better coverage in other states in the future. But it is something important to think about. What are the benefits of this genetic test for you if you're not already symptomatic? And what are the ways that that information could actually impact you in a way that you're, maybe not ready for or wanting to avoid. So genetic testing is always an option. We have other, if you don't want to do genetic testing, still come and talk to a genetic counselor. We don't force genetic testing and diagnosis on anybody. Um, and we can still discuss your risk based on a review of the family history and other things like blood work or urine screening.
Great. We had one follow-up. Oh, sorry.
I just wanted to add that the American Kidney Fund and other organizations are doing a lot of important work to advocate for better coverage of genetic counseling by government insurers, and as well as genetic testing. So a lot of great work being done to make the pathway easier.
Sarah, it's almost as if you're reading the questions that are coming in. We did have a follow-up clarification on that point, which was our genetic counselors reimbursable. And I think combining that with your early statement, it's that in for folks who have private insurance and somewhat in Medicaid, it's a little patchy, but there are a lot of payers who are covering it. But Medicare today does not cover it. And that's where, as you said, the American Kidney Fund has been just an amazing set of advocates for access to reimbursement for genetic counselor services in that space. Another question that has come in, and Mary Beth, I think this ties into to some of your indications for genetic testing that you talked about as well. For patients with IgA nephropathy specifically, which I think for a long time was thought of as an autoimmune condition more and less likely to be genetic. Are there things that we're learning about IgA nephropathy that are sort of changing the way we see that more people may actually benefit from genetic testing? Would it help people in clinical trials if they had genetic testing? What are you seeing from your vantage point there?
Yeah, great question. Not sure I can answer it completely because that's not a common indication yet in my clinic. When we see people with IgA nephropathy, we want to make sure that they don't have an alternative explanation, there's a genetic condition called Alport syndrome, which can present very similarly with blood in the urine, sometimes protein in the urine. It really comes down to the kidney biopsy a lot of times to differentiate IgA nephropathy versus Alport disease. So, yeah, I obviously need to learn more about the genetics of IgA nephropathy. I know there's been a lot of work done recently with treatments, and it's an exciting area. It's still not something that's being referred to me a lot for genetic counseling. How about you, Sarah? Are you seeing any IgAs in your clinic?
I don't know. So
Yeah,
yeah, we have a whole team of specialists in kidney disease, so I need to ask them.
yeah, yeah. Great question. Watch this space, I
Yeah.
suppose.
Mary Beth, within your answer was another question that we had before coming into the session that I think it would be interesting to get into. So, questions around APOL1 testing. For folks who have only had APOL1 testing, which I think is a practice in some cases, and maybe you can speak more to that, is there ever reason to consider additional genetic testing in those folks? Is it possible, maybe more generally, and Sarah, maybe you have a perspective on this, like, is it possible for people to have more than one thing going on? When do we have a conclusive answer versus when are we just sort of on a learning journey? How do you look at that, and how do you counsel your patients about that?
Yeah, this is something that I feel quite strongly about. So there are about 600 genes that can cause kidney problems. About 400 of those are currently available for clinical testing. And there are at least 50 or so genes that can present in a similar way that people with APOL1 mediated kidney disease can present, specifically with high blood pressure, protein in the urine, and that scar tissue on their kidney biopsy that we call FSGS, or focal segmental glomerulosclerosis. So I think that anyone that presents with a suspected inherited kidney disease, unless it's something that is very recognizable and specific, if there are, something on the imaging or the labs or based on the family history, we know exactly what gene to test, and we don't need to worry about those other 300 genes or so. I think everybody should have the option of having a panel test done, whether or not that's a broad hereditary kidney disease panel or something that's targeted to their disease. For example, an FSGS panel versus a broad genetic kidney panel. And those broad panels should include the APOL1 gene. It is absolutely possible for somebody to have high risk APOL1 results on their genetic testing and be unaffected. And the reason that is because this is really common. It's a genetic risk factor for chronic kidney disease. It's seen in about 13% of people who are African American or Black in the United States, yet only about 1 in 5 people with that high risk genotype or genetic result are going to have symptoms of chronic kidney disease. So it's very possible that you could have both going on, and that is something that we're still trying to figure out clinically. If somebody does have a kidney problem and they're tested and the only thing that comes back is high risk APOL1, but it doesn't really necessarily line up to the symptoms that they're having, is that still APOL1, or did we incidentally find that they had that high risk genotype, but it's not really the underlying reason for their disease? So I think there's a lot of research in that space, and it's important because that is one of the conditions that has a promising clinical trial. But we're not all the way there yet. This is a really complex disease. But I have had many patients who would kind of, fit the profile of somebody with APOL1 disease, and they've come back with a much more rare genetic kidney condition that mimics it, but would have very different implications for risk for their children, for their other family members. So I think it's really important to have access to all genes that could present that way, regardless of your ethnic background.
Yeah, and that kind of speaks to the fact that it's sometimes you might have a genetic test more than once. Maybe the first time a genetic test was ordered, it was a very limited test. So it's always worthwhile asking, is there a more comprehensive test that could provide additional answers for me, especially because our knowledge is evolving so quickly. And so there are more genes being added to these panels all the time. And so it's always good to have an updated genetic profile.
Yeah, on that note, I think these are really, really great points that you're both making. If you have genetic testing and they don't find anything, how would you encourage folks to think about that or interpret that if it's a negative result on genetic testing?
Do you want to start, Mary Beth?
Yeah, sure, I can speak to that. So different genetic tests might be used to look at different parts of your DNA if appropriate. So for example, we have a test called a chromosome microarray test that can look for missing or extra pieces of DNA and chromosomes, but can't spell check individual genes. We might use that if somebody has a kidney problem plus developmental delay, or intellectual disabilities. A gene panel, on the other hand, is like a gene spell checker, but it might not pick up on those chromosome problems. So depending on the person, you might have both or one or the other test recommended or something different. And it's generally not advisable to repeat the same genetic test in most cases, unless, like Sarah was saying, there's been a significant update in the technology or the genes that have been added to the test. In our clinic, if we do broad genetic testing for a suspected hereditary kidney disease and we don't find anything, we say it doesn't mean it's not genetic. It makes what we've already tested for less likely, but we can't rule it out because we know that genetic testing is not 100% going to find every disease-causing change that's out there. So I often have people come back to my clinic in 1 to 2 years, or if something dramatic changes about their disease process or their family history.
And I'll just mention another type of result that you can get is what's called a variant of uncertain significance or an uncertain finding. And that just means that a variant was detected, but we don't know if it actually causes disease. And so sometimes with those results, we just need to learn more before we can better classify that variant. And so sometimes those results will actually change over time, which is always why it's a good idea to check back in with your genetic counselor a couple years later to see if there's any new information about those uncertain test results.
Whew. We have covered a lot of ground in 40 minutes. Sorry, Mary Beth, did I cut you off? Did you have one more thing to add to that?
No, I was agreeing.
Okay, great. So we've covered access to counseling, access to testing, payment for counseling and testing, who should get counseling and testing, and some of the nuances to counseling and testing. We just have a few minutes left. And so in closing, what I'm going to ask Sarah and then Mary Beth to do is to share one thing you'd really like this audience to know about genetic counseling and testing. And one thing you would encourage our audience to do based on this discussion and everything they've heard today. So Sarah, starting with you.
Yeah. So, one thing I would love for everyone to take away from this session is that genetic testing is a key that can unlock new treatments, potential new treatments for you and your family. And the genetic counselor is can be your guide to helping turn that key and understanding what those results could mean for you and your family. So I would encourage everyone to think about ways that they can turn that key, encourage other family members to turn that key and access testing and counseling because it's a way to access new treatments for you and your family.
Yeah, I'll end by saying what I would like people to know is that if you're learning about a potential genetic problem in your family, it can be really hard to hear that there's a disease in the family that might be inherited, whether or not that's, you're sharing this information with your parents, your siblings, or your children. Not everybody is in the same mind frame as you when you're sharing this information. It's pretty common, especially for parents, to hear, if they hear that they have a genetic problem that might be affecting their children, they might take that really hard, right? That they might feel guilt or be angry. That's a common response. So I just want to acknowledge that it's difficult to hear when something might be inherited, and just give your family members grace and space if you are planning to share that information with them. And then the one thing I'd say to do would be to know your family history. It's really common for people to not talk about health problems, whether or not that whether that's because they want to shield you from that information and don't want you to worry about them, or if it's because they're private, and that's okay. And we have a lot of times where we see people who come and they say, you know what, I don't know anything about my family history, or I'm adopted, right? I don't know my biological family history, and that's totally fine. We can still have that appointment. It's not going to change what we offer for you, but knowing your family history at baseline, your family health history is something I would encourage you to think about doing.
It's such a beautiful closing. Thank you, Mary Beth and Sarah, for this really engaging discussions. Thanks to everybody who joined us today, and especially those who asked really great questions. Thanks to everyone, and I hope you all have a great day.